Hey everyone, this is Wade over at IMA. Today we'll be going over an NREMT style medical assessment video. You were dispatched to chest pain at a private residence.
Okay. Is my scene safe?
Scene is safe.
Okay. I'm going to do BSI, PPE, put on my gloves and all my safety equipment.
Okay.
I'm going to assume it's nature of illness.
Correct.
Okay. Is it just one patient?
Just the one patient.
Okay. I'm going to request additional EMS and consider C-spine until I see something.
Okay.
As I'm approaching, what do I see? Like, what's my general impression?
As you approach the patient, you see that he is pale, cool, diaphoretic, sitting on his couch. He is tracking you with his eyes.
Okay. So I'm going to go through AVPU. Hey, how you feeling today? My name's Christian. What's going on?
My chest has just been hurting for a few hours.
Okay. What was your name?
My name is Jim.
Jim. Nice to meet you, Jim. Do you know where you are?
I'm at my house.
Okay. Do you know what time it is?
It's in the afternoon sometime.
All right. And do you know who the president is?
Biden.
Okay. And so what's going on? You said you had some chest pain?
Yeah, I've had some chest pain for a couple hours since I started mowing my lawn.
Okay. So we're going to take a look at your airway. How's the airway?
Airway is patent.
Patent? Okay. We're going to take a look at his breathing. How's his breathing rate, rhythm, and quality?
He is breathing shallow at an elevated rate at a normal cadence. Okay.
We're going to put him on oxygen, high flow, 15 liters via non-rebreather.
Okay. Sounds good.
And then I'm going to assess his circulation. How's circulation?
So what are you looking for?
How's his pulse? I'm going to check a pulse. Does he have one?
With his pulse is present.
Okay. And I'm going to get some additional information based off circulation. How's his skin?
Skin is pale, cool, diaphoretic.
Okay. And then let's get some vitals. Do we have a pulse rate? Can I have a pulse rate?
Pulse rate is going to be 120.
120? Okay. What's his blood pressure?
Blood pressure is going to be 90/60.
Okay. So it's a little low. What's his O2 levels?
O2 sats are 97% after the non-rebreather.
Okay. What's his BG?
BG is 120.
120, okay. I don't think I'm missing one. Transport, I think he's a high priority.
Okay.
So we're gonna transport stat.
Okay.
And I'm gonna ask him some questions. So signs and symptoms, what was going on? You just said some chest pain?
Chest pain after mowing his lawn.
Okay. Are you allergic to anything?
Says he's allergic to penicillin.
Penicillin, okay. Do you have any medications that you're taking?
Yeah, I take a blood thinner called Eliquis.
Okay. Do you have any medical history I should know about?
I've had 2 heart attacks in the past, and I have atrial fibrillation.
Okay. All right. What was your last oral intake?
I think I had some juice like an hour and a half ago.
Okay. And what happened leading up to this?
I was mowing my lawn, and then the pain just started grabbing a hold of my chest.
Okay. Okay, I'm going to start my secondary assessment.
Okay.
So what were you doing when this happened?
I just got done mowing my lawn.
Okay, and then does anything make it better or worse?
If I relax, the pain kind of goes away a little bit.
Okay, does it move around at all, or is it just in one spot?
Pain is moving into my shoulder and into my neck as well.
Okay, and could you describe the pain for me?
Yeah, it feels like just an elephant sitting on my chest.
Okay, okay, and then on a scale of 1 to 10, like how bad is that pain?
Probably a 9.
9? Okay, and then when did this start?
It started a few hours ago. I'd give it 3 hours or so.
3 hours? Okay. And do you feel like lightheaded or dizzy at all?
A little lightheaded. I did get close to passing out one time.
Oh, you did? Okay. I was going to ask that. Do you have like a family history of this?
I do. My dad died of a heart attack, and so did my grandpa.
Okay. All right. So I'm going to give you some aspirin. I'm going to give you 4 81 milligram tablets of aspirin.
Okay.
Just to help with your chest pain.
Mm-hmm.
I'm not going to give you, or you're going to chew and swallow that, and I'm not going to give you nitro because that's going to drop your blood pressure more, and I don't want to cause any more problems.
Perfect.
Or kill you. So.
Patient does take medication as instructed.
Perfect. And then we're going to transport, and I'm going to assess vitals every 5 minutes just to make sure they're doing okay and keep an eye on them.
Mm-hmm. So what do you think is going on with this patient?
definitely we're having some heart problems for sure.
Okay.
You want like a specific? I definitely say we're getting near a heart attack.
Okay, perfect.
I'm going to take a second set of vital signs. Can I get a blood pressure?
Blood pressure is 100/70.
Okay. How about a heart rate?
100.
Respiratory rate?
24 breaths per minute.
And how's the O2?
His SpO2 is remaining at 97% after non-rebreather.
Okay. All right. Hospital Medic 1.
Go ahead, Medic 1.
Medic 1's en route with an adult male with complaint of chest pain. His vital signs, his blood pressure is 100/70, heart rate's 100, respiratory rate 24, and oxygen on 97%. We've given 324 milligrams of aspirin, and we've put him on a non-rebreather with 15 liters of oxygen, and we have an ETA of 10 minutes.
Copy that. See you in 10 minutes, Medic 1. So that went very well. You did pass. A couple things. You noted that there was a pulse. That's good to find out. We just are looking for the rate, rhythm, quality. Okay, so make sure we're really paying attention and assessing that. Outside of that, the first respiratory rate you knew was elevated. You just didn't get a number the first time. Outside of that, the whole thing went very well. Good job.
Okay.
So this is where we got to ask, like, you know, do you have a family history? Do I know any edema? Have you felt like you're going to pass out at all? You know, any like lightheaded, dizziness type stuff?
Okay.
Think of what cardiac could do, right?
Okay.
So lightheaded, dizzy. I think that's important to ask. So, you know, do you have a history of family heart problems? Because you know he has a history of problems, right? So any family history of heart attacks? You know, are you feeling lightheaded, dizzy at all? Have you gotten close to passing out? I think if you answered those 3 questions, that should be enough to clarify, or ask those 3, and just make sure that you verbalize after you've clarified, we're going to give aspirin, right? And then say, I'm not going to give nitro because of blood pressure.
Okay,
right?
So then just kind of ask him questions about if he's been dizzy, lightheaded, if he's got a history of this, his family history. Okay, so like onset is when?
What were you doing when this started?
Okay, so you were mowing your lawn when this started?
Does anything make the pain better or worse? Okay. That's provocation. Quality, can you describe the pain? So is squeezing, dull, sharp, achy?
Okay.
Is it moving anywhere? And then severity 0 to 10, and then what time did this start at?
Does it move? How painful is it? And when did this start?
Yep, and remember with how painful, 0 to 10.
Yeah, okay.
We want a number.
How painful, 0 to 10.
So from the top, right? What were you doing?
Okay, what were you doing?
Anything make this better or worse?
Okay.
Can you describe the pain for me?
Okay.
Is it moving?
Yeah.
0 to 10, and then when did this start? Okay. So as you can see, that was an NREMT medical assessment proctored video. Hopefully this helps you guys out. Like always, don't forget to like and subscribe over at Idaho Medical Academy on our YouTube page. We'll see you next time.